Good morning, everyone. It is my great honor to be here to present the Twin for Healthcare and Architecture Challenges. My name is Tuan. I'm a senior lecturer at Middlesex University, London. My background is on wireless communication, so a little bit different from expertise. So I try to come with approach from different angle from the communication approach. If you could go to the next slide, please. Yeah. So this is the content of my talk. I will briefly, yes, it's well defined by Proprioti and Dr. Sovic. I will re-echo some key points there. So I will talk about some features of a digital twin system. Then I talk about the healthcare system with the benefit of the system with digital twin. And then I discuss some architecture of the system, some applications, and then challenge that I see. Go to the next slide, please. Okay, so yes, thanks to Prof. Jordi and Dr. Sovic. I think it's the clearest to use that distinct of anything. It's a mirror or replica of an object or system procedures. Okay, so it is very important that the distinct should have an exact model of what it is in physical domain. Also that the digital twin should host the data of that actual system or physical system, the data in the past and the current state of the system. Could you go to the next page, please? Okay, so I'd like to highlight that digital twin is not an avatar, whereas it's the limited replica of the real system where you don't have the ability to control the actual thing. That is not digital twin. Digital twin is not a simulation, which is having a assumption and simplification. So it's not a real model. And it is not an augmented variety of, which is only focused on the interaction of human and the actual thing. So this is not of that. If you could go to the next slide, please. Right, so as you can see here, key features of a digital twin system, it consists of the real one, or we call physical presentation, an object, procedure, anything. It has a copy of that on the right-hand side. And an important here we should have is the connection. It is kind of communication between that virtual one and the reality one. So the more advanced in terms of connections, or you have the more updated information, data, or the state of the actual system, that's the more accuracy that digital you can have. Okay. So a feature of the digital system is that it should have modularities properties. So it has, you need to have the ability of decompose this whole system into much more smaller systems so that you have replica of whole components of system so that you can allow the system to be involved. For example, if the technology change a certain thing, you can update that individually. Okay, so you should also have the interfaces between the components within the system so that you can easily interchange. The highly modular is the better you have in terms of adapting to situation. So that think of when you want to design a car, for example, you have different models that you have different copy of, let's say, the engine, the brake system, so that you have almost components a copy in the virtual system. So let's say if you want to upgrade it only, so have the ability to upgrade that single component of the system. So it allows you to adapt to the change in the technology certain area, for example. And for that, it allows you to have a hybrid between the reality and the simulation. So for example, if you wish to have some feature in the future, but you don't have the technologies that allow you to do at current time, you can connect that thing by simulation with that real stuff. So it allows you to do hybrid testing and development. Okay, so Another feature of the digital twin is that it allows us to have remote intelligence. So think of, let's say you have a system of, so we try to collect some data from um, patient, for example, but you have the device, wearable device you have is quite limited in terms of computational capacity. So with digital twin, you have the ability of processing the data into the cloud or the edge of the network. So for that, it allows more intelligence to the even very old version of the wearables devices. So for that, you have you provide intelligence into the limited resources system. Could you go to the next page, please? Right. If we have the digital twin, we have a life cycle of a network. So in the picture like that. So first step was the design system you want to design. Here I take an example of a telecommunication system here, where first you try to design in the virtual domain and implemented this. In the design process, you have ability of testing all the what if scenario, all the changes so that you find optimal designs. Then you can deploy this. At the second state, in operation state, you have the ability of predict situation within the working system. And the next state is that you can expand the system. You have the ability of providing new services, for example, new features by testing using the virtual version of that. And the circle go around like this, so it allows you to involve the whole design. Could you go to the next page, please? Right, here we look at healthcare system. As clearly mentioned by Dr. Sovic, we have different parties playing that the system here. We have people, which is putting the requirements on the system, like a patient want to be take care of. We have organization, the providers. We have people like doctor, nurses. So all are contributing to promote or restore or maintain the health of the people. Could go to the next page, please. Yep. So the benefit of having between the healthcare is that if you look at the organization aspect, we can reduce the time, wasting time or treatment time. We can reduce the workload in hospital. Imagine in the UK, we have quite high demand in terms of hospitalities. So the waiting list is quite long. Even for example, my daughter has something with her eye. It's been booked for a year, but she hasn't got been looked by the doctor yet. So that kind of thing, we have to have something so that we can shorten the wasting time. So on for the other thing, we can maximize the utilization of the equipment. For example, we know a certain time the demand on certain machine devices are high, well prepared beforehand. Yes, we can prepare the patient, for example, before they go to the hospital. So we can train them using certain equipment, for example, by using the virtuality. We provide them that abilities so that we can shorten the times for administration. If we look at the personal thing, as mentioned by both Yodis, we have the ability of training doctors, nurses, or students in terms of we don't have to actually do on the real patient. We can do that virtually. So it's the benefit of having the digital. We can evaluate a new way of treatment. For example, we can test before we do on the real person. If we look at the supplier, we can look at the example of drug development here. We can shorten the time of develop a new drug. We can have personalized drug for certain people if we have the right model of that person. We can reduce the risks or net the risk side effects for drug for different people. And yes, as mentioned well by both studies, that we can provide resilience in terms of avoiding or predicting coming pandemic situations. So that's all about benefits of having students in healthcare. If you could go next page, please. Yes. So yes, if we have digital twin, we can provide better security. For example, in current system, we have to share the data. Um, Even if we have a system of a computer network advanced, but if you want to say between different hospital, there are risks of uh, breaking that privacies. And having that, looking at communities aspect, we can reduce amount of communication within the system because we can design the optimal way of exchanging information, exchange the data, and so on. So it is very clear that having digital in healthcare, it helped a lot. If you could go to the next, please. Right, here I would like to present architecture of, for healthcare. So the circle, we have a physical interaction layer here, which represents the patient communities and healthcare communities, and they interact physically interact with each other via devices, equipment, for example, ambulance, gadgets, health, or for example, medical applications. Yep. And we have a virtual copy of that in the middle here, which is the digital twin. If you could go to the next page, please. Right, if we look at the patents community here, so they are the person who puts the requests on the services. For example, looking at the certain disease, they have affected by a certain disease, so they have requests be responded by doctor. So the patent communities here provides or connect to the digital by either wide or wireless connections. So for example, they have some data, testing data, or measuring data by wearable devices. So they provide that data through the digital by the connection. Important thing here is that where do we store data? Should we store it close to the patient? For example, she is at home. She had access point at the Wi-Fi router, for example. Should we store somewhere close to her, or should we put that data into the cloud? So that is a question to be think of when we design the system. If you could go to the next page, please. We have a healthcare community here. We have multiple levels like doctor, nurses, clinical specialists, pharmacists, etc. So they perform action towards patient communities. So they can do testing, they can do the treatment, things like that. They can, having the digital here, they can avoid contacting to the patient for very infectious disease. For example, they don't have to actually see the patient face to face. They can try the things using that digital. Okay, if you could go to the next page, please. Right, here we have important layer here, which is the layer. So as well mentioned by Dr. Sovik, here we have data collected by the system, and then that digital here process data using different kind of model or AIs, for example, to process that thing. The thing I want to pay attention here is that because we have that here, the question is that where do we deploy that thing again? At edge of the network? By edge, I mean that closer to the user as a patient, for example. Or should we deploy this thing on the cloud? They are balanced. Should we think of, for example, if we distribute at the edge, we have the benefit of low latency. It means that the decision is very fast. It's because we have less delays in terms of transmitting between the user and the system. However, we face a problem of having low storage, low computation capacity, that kind of thing. At another extreme, if we put everything onto the cloud, we have the computational, better capacity of storage. However, you have to face between the latency, the long to the response time. So we have somehow to balance between those things when we decide in what application we should deploy at what level. Yes, it could go to the next page, please. Here we mention some applications of treat in healthcare. We can have drug development where we have companies try to come up with new drugs they can test using nutrient testing virtually. Don't need to put in the real person. We have trauma management here, so we have hospital nutrients, so we can well prepare for the patient before they coming to the hospital. Because with that, you can predict at that times you need to go to the hospital to take certain tests, and the system will train her before coming to the hospital. So you know how to prepare for the test, for example. So kind of thing is it's helped by this student. And also, as we mentioned earlier, we can maximize the utilization of equipment within the hospital, shorten the supply chain, etc. We can have application like patient monitoring, so that we can have we monitors the patient remotely from home, for example. We can have dialogue and treatment by student. A third thing here we have to have, for example, if we look at the people now trying to develop the virtual human, where they try to develop the virtual brain, virtual heart, etc., virtual kidney, for example, and then they try to capture the real thing, and they can explain on that virtual organs of the human, so that they can try different drug, different method. Okay, if we could go to the next page, please. Right, there are some challenge. I'm looking here at the aspect of human. So building a virtual organ or copy of person is it's not an easy task that we may not know clearly about how our brain, for example, be organized. So this is very complex object. So if we can come up with close to realities, it is better. Okay, so because the accuracy of that model affects behavior of the student and the level of response that we put to. And against edge-based or cloud-based is important question to ask. Another is collecting information from human organ is not easy. If you want to have the real, very close copy of the brain, is tough. You have to think of how do you send the information, how secure that thing can be. You know, when you have something that communicate with devices, you have to think of the security. And yes, cloud-based versus edge-based is most important thing when we think of when we start design the system. Okay, so with that, I'd like to thank everyone. You could go to the last page, please. Thank you. I want to thank the Petit Council and UGM for having me here. Thank you so much.